Good morning. It's Wednesday, April 5th, 2017, and we're in the Senator Hearing Room, Courthouse Square, 555 Court Street Northeast in Salem, for a weekly Board of Commissioners meeting. So let's start that meeting with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, and again, good morning. It's been a busy morning for us already. We went down and testified before the legislature. Commissioner Carlson did great. I messed up the chairperson's name. I hate that, but we got our message across. Commissioner Cameron is staying up there, and there's a child abuse prevention ceremony going on right now at 10 o'clock. So hopefully he'll join us a little bit later. Our first item of business is a presentation. It's about the Marion County Employee Food Drive to benefit Marion Polk Food Share. And we have Rick Goppo, Gordy Nash, and one other, but I don't know if that other is joining. So whenever you're ready.
That's my prop.
All right, are you beginning this, Gordy?
I am.
Wonderful.
Good morning. My name is Gordy Nash, and I work in the board's office. And each spring, we begin, spring, it's kind of into the summer sometimes, but we have a food drive to benefit the Marion Polk Food Share. And we have events, we have ways to donate. And sometimes people can't really relate to the needs of your neighbors. Sometimes you don't even know that your neighbors are in need. But I have had personal experience. And when my children were young, my husband was partnering with a man who they did computer sales of computer parts all over the world. And there was a change in the economy. And one day we had a bustling little business, and the next day we had nothing. And we had no income. And we had bills, and we had a big refrigerator that was empty. And we had difficulties for many months. Nobody around us knew. We lived in a big, giant house with 6 bedrooms, and it was beautiful. And however, we had friends, and about a week before Christmas that year, a big, giant truck backed up into our driveway, and 2 men hopped out and started carrying boxes of food into our house. And then they brought Christmas presents. And then they gave my husband a check. And he started crying, not me, but he started crying, and my husband. And it wasn't the fact that we had food, because we knew that we would make it, but it was that people cared. People cared enough to give. And so my choice to head this up has to do with giving to people who have needs. And a lot of times we think about people taking from the food share, taking from different places as an entitled group of people that don't do anything and don't, they just aren't working. They aren't doing anything. But you know what? It's just not like that. There are people out there that just need a hand, and that hand can give hope that will change a life. It turned our lives around, just that one little thing. And so I just want to encourage everyone to join in and give where you can. We have a website for the food drive, and on there's places where you can sign up to give monthly. There's a calendar of events. Next week we're going to have a pizza lunch. There's going to be boxes out near the elevators that you can give the 10 most wanted cans of food. You can write a check. We're going to have events that you can participate in. And what we'd really like to do this year is just give more than we had last year. So I'd like to introduce the president and CEO of Marion Polk Food Share, Rick Goppo.
Hi there. Thank you so much for letting me be here. Again, Rick Goppo. First of all, frankly, nothing I'm going to say is going to be better than what you just said, and I really appreciate that. Personal stories really matter. We do connect with one another. That's what makes it work. So I'm gonna let me just share a couple things. First of all, Marion Polk Food Share, we're kind of making some mental shifts that are right kind of in line with what you were just saying. So one of the mental shifts is, for a long time, we've described ourselves as Marion Polk Food Share, the regional food bank of Marion and Polk counties. And we're switching that language. So we're the regional food bank serving the communities of Marion and Polk counties. And that shift might not sound very dramatic, but it's a sense that it is communities caring about their community that's really matters. And so when you said your neighbors and your friends came and supported you, we're thinking about what our role can be to make that sense of caring, that sense of support for our community greater. And so, again, this is kind of wonky, but this is really some shift in thinking we're doing. We're serving the communities of Marion County. We're stressing community building as part of our role. So we deliver food boxes. We do that all the time. We're really excited about it. But we're also increasing our community meal sites. If you've been out to the Kaiser Community Meal Site, that's new. Well, now it's about 15 months old. But last year, they started doing a monthly meal. And they were wondering how many people were going to come. Now about 200 people come for that monthly meal. And it is a meal for the community. And of course, the hungry come. But it's not a meal for the hungry. It is a meal for the community. And the hungry come. And so we're trying to create this sense of community building as integral to how we work and support one another. Some stats that you might find interesting is in Marion County, monthly, about 30,000 people are receiving some support through the food share. Again, that's mostly food boxes, but that does include our meal sites, that includes Meals on Wheels, that includes participation in the community gardens. And when we transfer the community goodwill into a monetary impact, so when we talk about the food that the community helped us disperse, and then we transfer that food into an economic impact, that food economic impact is about $5.6 million worth of economic impact that gets distributed to Marion County residents. And really, that goal is that $5.6 million is to help their life not spiral downward. So if you need a food box, generally, it's for an episodic period of time. It's not a chronic period of time. It's a moment in your life. That moment can be several months, but it's a moment. And without that food assistance, then people are making some really, really tough choices, like food or housing, food or this or that. And so that $5.6 million of economic value is helping people not make those tough choices that then help life spiral downward in rougher and rougher situations. A partnership that you might not know about, because this is, maybe 6-8 months now, we're partnering directly with Marion County Sheriff's Department so that they have what we call as after-hours boxes. So if the sheriff comes across somebody who, frankly, what they need now is food in the moment, and there's not good access to a pantry, sheriffs are carrying 1 or 2 after-hours boxes. These are just really kind of small boxes of food, and it's really to say, here's some food tonight, and here's where your pantries are tomorrow that you may be able to get some assistance. And the Sheriff's Department came to us and said, because they knew that we were doing that program in a different way somewhere else, and they said, could we do that? And so they have boxes in their car, and then they have a few more kind of backup boxes in their office, and then when those office boxes run down, we just replenish those after-hour boxes. So that's a fairly new partnership. And most people know Marion Polk Food Share for the work we do around food boxes, but again, we do community meals, and about 2 years ago, we took over in Marion County, specifically in Salem Kaiser, the Meals on Wheels partnership. And so we are now delivering Meals on Wheels to about 400 seniors in our community every day. And we really expect that number to grow. And what's been wonderful about the Meals on Wheels program is, while it's a relatively new to us, 2 out of our 30 years of existence, it feels as much of a heart of our organization as food boxes and meal sites. So that's just some of the stuff we're doing right now. It's really great work. The county and the community really make this happen. There's no version of what we do that happens without community support. So if you had any questions, I'd be glad to answer them. But just, again, the appreciation for the county. And also, if you ever want to speak or to any of your departments, I'd be glad to do that. So.
Well, I do have a comment. First of all, thank you for being here. And Gordine, thank you for sharing that story. I had never heard that story before. It was very touching. So I just wanted to say that this is really an important thing that we do in Marion County every year. What they call food insecurity, people not having enough food, is real. There's lots and lots of people that every night go to bed hungry. It's interesting as I'm thinking back, we had 2 foster children in our home for a period of a little less than a year, and when they first came to our home, they were friends of our children, and won't get into the story about how it happened, but one of the things that I vividly recall is that when I would go up in the bedroom where they were sleeping after they had gone to school, I would find food wrapped up in napkins that they had put into closets or corners or under the bed or under their pillow. And when children aren't sure where the next meal is going to come from, hoarding food is a common thing that, and I learned this later, which then speaks to the emotional toll. It's not just a physical toll of being hungry, but that fact that they're insecure and the fact that they'll have food. Secondly, nutrition really counts. I think you have your list of 10 foods, and I'm sure that on the website that's important, but to make sure that what we're providing to people is actually going to give them the nutrition they need. And I've just been so impressed with what the Marion Polk Food Share has done over the years to be so innovative in coming up with nutritional foods. And Rick, maybe you can speak to that a little bit when I get done with my comments. The third point I wanted to make is that a lot of people think that food boxes aren't necessary because we have food stamps in the United States of America. But I just want to point out, I have a friend, and she is disabled, lives on disability payment. That I could go through the budget with you, but there is not a whole lot left over after rent to be able to provide for her needs every month. And her food stamps that she gets do not last much longer than a week or two. I mean, it's a very minimal amount. And then the irony of it is that she became employed as a mentor through the Marion County Health Department with people who are mentally ill, and she had a couple cases and made $80 a month, $160 a month, and when she reported the income, they actually eliminated her food stamps. So there's really something wrong with the system. I'll just put that out there. And then the last thing I wanted to say is that not only does Gordine show her inner spirit and motivation, but she does a great job organizing these food drives every year, and she does a lot of the other drives that we do too, United Way and some of the other causes that we work with. And we have, for those activities, oftentimes raffles, and so I'm always bringing little trinkets and things year-round that we can do for that. So I want to encourage people, if they're listening, to think about how we can contribute to the cause through the events, and also if there are things that you get in the mail or you get as a gift, and it's not something that you think that you could use, but would be something that would be great for a raffle. That's another way that you can contribute. But I guess, too, that providing money, I think, is probably the best way that people can contribute, because then the food share can look and see where do you have deficits in that stock of food that's necessary. So I would urge people, even if you just give a little bit, every little bit helps. So those are my comments.
Thank you. You're right. Nutrition has been a huge focus. We're long past the days where we think of food as food. I mean, as all food is equal. Potato chips and potatoes are not the same. Coke and milk is not the same. And so we put a huge focus on nutritious food. We're also now partnering with Salem Health more deliberately. And so we have a pilot program where if you're, specifically if you're a senior, but if you're somebody being released, what do you say when you leave the hospital? It's not, I don't think you say release, but anyway.
Discharged.
Discharged,
I
thank you.
think
Release,
Lauren did that.
release sound much more ominous, but when you're being
Right.
discharged, oftentimes it's not medicine you need, it's good nutrition. Your nutritional intake was part of the reason you got to the hospital, or your lack of nutritional intake. And so we're partnering with the hospital for delivering high-quality food boxes to seniors being discharged. And we're looking at, and I think this is going to happen, so next year I can tell you if it happened, but we're looking at having a food pantry right in the hospital for discharged patients. So,
Well, thank you both, and Commissioner
Thank you.
Freewell covered my thoughts. Gordine, your story did kind of bother me. I'm glad Commissioner Cameron isn't here. He'd still be leaking, you know what I'm saying? Yeah. Thank you both for the good things you do, and good luck on your efforts.
thank you for the long-term support.
So, next item is our consent calendar.
All right, Mr.
Carlson?
Chair, yes, back, I'll have to get into
Has to be your
practice
turn.
again, right, yeah. So I'll move today's consent calendar. There are 4 items. The first one under Board of Commissioners is approve an order appointing Carrie Moeller to the Marion County Public Safety Coordinating Council, and that's in her new role as the Marion County Health Administrator. So we're excited to have her join the council. Under Clerk's Office, approve Amendment Number 1 to Lynx Group, Inc. to add $30,500 for ballot services. Under Community Services, approve an order appointing Wendy Valise to the Economic Development Advisory Board with a term ending June 30th, 2020. And under Public Works, approve the intergovernmental agreement with the City of Woodburn for development and future annexation of property in the 15,500 block of Butteville Road Northeast in Woodburn.
I'll second the motion. It's been moved seconded then to approve the consent calendar. Any further discussion? None, all in favor then say aye.
Aye.
Aye, motion passes. Thank
You
you.
notice I cleverly inserted my discussion in as I was reading the.
Very nicely.
Okay, thanks.
We have 3 action items this morning. The first, under Business Services, we consider approval of a contract for services with Oregon Lock and Access for $150,000 to provide access and security controls to various county buildings. Colleen Coons-Chaffins is here and going to lock up the subject.
Good morning, Chair, Commissioner. Colleen Coons-Chaffins, Business Services Director. I'm here to talk to you about continuing a service contract with Oregon Lock and Access to provide medical keyway access and security control. The contract term is retroactive. We've been working on this. We came to you before on February 15th as a sole source procurement due to the proprietary keyways that Oregon Lock and Access have. So I'm asking here today for your approval of a contract amount of $150,000 in order to get this going.
All right, questions or concerns?
I read in the write-up that there's a movement towards more of the electronic locks and less of the hard key locks. Can you just maybe give us for people who might be listening,
Sure.
kind of the focus of that?
We're moving from a lot of the hard keys where we can to basically key cards where your access can be monitored and tracked. And part of that is really just an ongoing commitment to make sure we know who's in the building, when they're there. We can schedule opens and closures as well as who has access to specific areas. So that's what we're really getting down to. My team is going into the departments and auditing with the departments. Who's doing what, why they're there, so just so that we have justification for those. So they're already doing that, working with departments, talking about your 6 people have access to here, should they all have that access? So we're confirming with the departments, with their managers and supervisors as to why they're there. That also ensures that people aren't getting access to information they shouldn't be.
And then just one other question. Several months ago, we had a report from some auditors that came in looking at IT security and whether they could get into secure areas.
Yep.
Does this company have anything to do with checking to make sure that locks are properly installed, or is that facilities?
That's facilities does
Okay.
that primarily. We do use Oregon Lock as a kind of an audit. If they have new technology that's coming in that's better for that application, they are helping us with that. But facilities typically is the installer unless we get into a big complicated system like the door operators and some of those things.
Okay, great, thank you.
So I've never thought of this before. Does this company, do they actually control like like programming the card keys and stuff, or we do
Not
that
this
in-house?
company, not Oregon Lock and Access. We have a company, Resecurity, that controls that programming, but our staff have control over that. So on a daily basis, we get calls at night saying, I'm stuck, I can't get out, and so my staff get those phone calls.
But they're kind of unique that I never thought about, maybe the public hadn't, that some let you go some places and some let
Correct.
you go all places. And so
That's-
somebody
that's-
has to be making that designation and seeing what's appropriate for each individual key.
Correct,
rating.
and we have certain criteria for level 1, level 2, level 3, people who are allowed to do what at certain hours, certain buildings, those kind of things. So our people program that to make
that's
sure
what I
it's
was
in the
wondering.
proper order. And we usually, when that happens, we do come to the board to make sure you know who's on that list, so you understand what their role is in that.
I didn't catch that then. But anyway, anything else?
No, very good. I'm ready to make a motion then.
Great.
Okay. So I will move that the board approve the contract for services with Oregon Lock and Access for $150,000 to provide access and security controls to various county buildings.
I'll second it. So it's moved and seconded to approve contract with Oregon Lock and Access. Any further discussion? Don't hear any, then all in favor say aye.
Aye.
Aye, motion passes. Thank you, Colleen. Then you're
Thank
up
you.
to the next one too, where we consider approval of a contract with Summit Engineering LLC for $136,590 to provide architecture and engineering services for the Marion County Transition Center Roof HVAC project. Colleen?
So as you know, the Transition Center Roof and HVAC project has been something we've been working on. And so in December, we did an RFP, request for proposal for architectural and engineer services for the Transition Center. And after a review of the proposals, we came up, the team evaluated that, and Summit Engineering was selected for the contract award. Summit Engineering is working with a team of subcontractors who also help do some of the assessment and engineering studies behind the HVAC and the roof, and basically combining the project to make sure we're doing one system for both and making sure that they're going to work together properly. So Summit Engineering was awarded $136,590, or will be awarded per your approval.
It's pretty routine follow-up. Any other thoughts?
No, I really don't have any questions. This is, this transition center issue has been long-standing, I guess, and it's really good that we're moving forward and trying to get some resolution to it, so very much in favor of this. So I'll go ahead and make the motion to approve the contract with Summit Engineering LLC for $136,590 to provide architecture and engineering services for the Marion County Transition Center Roof and HVAC project.
All right, I'll second the motion, and that we can track with Summit Engineering for Transition Center Roof HVAC project. Any further discussion? Hear and see none, all in favor then say aye.
Aye.
Aye, motion passes.
Thank
All right,
you.
Thank you, Colleen, for both these items and all your good work.
Thank you.
Our last item this morning is under health. We consider approval of an order that establishes fee schedules for alternative payment methodology case rate for crisis services of Marion County Health Department. And Ryan Matthews, you're alone. It says you wouldn't be, but I hope you're.
I am. Carrie's actually at a conference today, so
Okay.
she was unable to make it. So I'm here on behalf of the Health Department requesting approval for 6 new fees to be added to our county fee schedule for our crisis program. Just to add a little context to this is part of a project that we've been working on with the BCN, Willamette Valley Community Health, and in partnership with Polk County and a Medicaid consulting group to develop alternative payment methodologies for our specialty county behavioral health services. So what this project's been working on is to sort of scrutinize some of our specialty services, increase our accountability in terms of our ability to bill our actual and appropriate costs to our payers to sort of justify the funding that we receive, and to ensure that what's being built into our rates are Medicaid allowable expenditures. So just to sort of update you on the first phase of this project, in June we received board approval for 4 APMs that were developed around our high fidelity programs. This would be ESA, Assertive Community Treatment, High Fidelity Wraparound for Kids, and Supported Employment. And those were to be effective July 1st, 2016. And so we recently looked at sort of how our billing patterns have looked from July 1st through the end of December, kind of that 6-month period. The claims that we submitted to the BCN for the services we provided were about 2.6 million under those first 4 APMs that we developed. And had we sort of continued to bill under the old methodology before the APMs were developed, our encounter data would have been about 1.6 million. So we were basically able to capture an additional $1 million of costs that we were spending on the services we were providing, but that we weren't able to capture and submit claims to encounter that service previously. So we're hoping that these rates for crisis services kind of follows that similar pattern of that there are services that we provide that are not easily captured sort of through the general traditional billing codes for, case managements and crisis assessments and things like that, and that these APMs that were developed and supported by the BCN can help to truly capture the costs that are part of our crisis program.
Commissioner, I know you've been talking about aspects of this for a long time.
Yes, so first of all, very pleased that we're moving forward on the crisis elements. I know that was going to be tougher than the high
These were
fidelity
a challenge
services.
for sure, yes.
Right, and so I'm looking at my calendar. It looks like we have a work group meeting next week with our consultants. Is that still on, even though we're approving that?
I believe there's, Cindy Becker had mentioned about potentially not having that meeting, so I don't know. That one was actually not around this group, because we already met around the crisis services, and I know the BCN has added the crisis codes to their fee schedule, so that's why they're sort of hoping to prompt that. That one was for some some wraparound services to our adult population. Which we've gone through the work with the consultants and we've established a document, but I think there was some still discussion on the BCN part and as to sort of kind of where to take this in the future with that specific APM in mind. So I think we'll have to confirm whether or not that one is going forward or not.
Okay, I was just going to look, and I think it's still on my calendar. Is it still on everyone's calendar?
I think it is, but I know there was some just discussions with Cindy that made me think that perhaps that one was not going to happen, but we'll have to confirm that one. But I do know that effective April 1st, for dates of service April 1st, these 6 billing codes have been added to the BCN fee schedule, and so there's a hope that we'll start utilizing these.
All right, so did we already go through the papers on the crisis services
We
at the
did,
last
yes.
meeting?
It was a few months ago. We hit some snags with sort of the secondary stage of all this is getting these codes established so where we can actually start using them with the state. And I know the BCN, Cheryl Henning, had been working with the state on establishing some of those and sort of getting PH Tech and sort of the infrastructure ready to handle these codes, which we were given the green light a couple weeks ago that they're going to be ready to go.
So has it been additional workload for your staff to use the APM methodology?
I think for the first 4, the additional workload is pretty minimal because it's sort of a monthly case rate, so it's not a significant. This, I think, will internally be a little bit more of a challenge because it's going to physically change sort of what we consider to be a service. So if somebody comes into our psychiatric crisis center on a Wednesday, this is sort of built to be like a 72-hour sort of length of duration of a crisis incident. So if they come back on a Thursday, it won't be as simple as saying, well, we're going to bill another encounter because they came back that second day. It would sort of be part of this prolonged episode that's under this case rate. So I think there will be some sort of additional billing processes to make sure that things don't get miscoded and things get billed appropriately.
Right, so you'll have to audit or
Yes,
review.
yeah. So we've got some sort of on that back end, not so much on the front end with the clinical staff entering the service tickets, but more on the back end with the billing to make sure that we're capturing and catching some of these sort of quirks that are associated with these APMs.
But I think, if I could just say an editorial comment, I think that the way, if using Psychiatric Crisis Center as an example, if you were only billing for the assessment, and so that's all you could bill for, and then the hospital says, well, we'd like to do the assessments, then all of a sudden you're in a competitive thing. Well, no, we have to continue doing assessments because we can't give any to the hospital because that's our only way of coding and accounting for that contact that we had with that person.
Right. Yes.
So I think, so it should result in, like you were talking about with the other services, a more sustainable, certain ability to track and encounter the visits that you have from people at that center.
Right, absolutely, and I think all you know, the BCN as a payer is sort of invested in that too, and that, I mean, they want PCC to be sustainable and to have a funding source that is both sort of accountable to the services we provide, but also that will sustain that as a resource for our mental health system. I mean, obviously they play a large role in the crisis system, and so I think with some of the other APMs, like for example with mobile crisis, it's kind of a similar thought process, is that the state gave us a lot of funding to sort of start these mobile crisis teams, but as with anything, the state tends to fund it at the beginning, but then you have to find sustainable ways to sort of to grow that service and maintain that service. So we're hoping that being able to develop some APMs to be able to bill for some of these services that are part of those teams will make us less reliant and dependent on state funds, and we can either expand into other cities, which we've been looking to do to spread the funding further from the state, or as state funding cuts inevitably come down the road, that we'll be able to still sustain these teams ongoing.
Okay. And so other than this last work group meeting, are we done with the contract then?
We are. Our last rate that we were to develop was our wraparound for adults, which we did complete. So the work that we're doing with the consultants currently has run its course. We've kind of identified all the areas and we've completed those. I think that there's still some discussion about the BCN potentially looking at something as a broader kind of across the panel work, potentially with either Tri-West or a similar group to look at APMs, which we would be happy to participate as part of if there's ways to look at kind of other services that reach across. We sort of focused on the specialty county services. Now I think they're kind of looking at, okay, what are the services that are more across the system, and are there better ways that we could capture costs and pay for the service? So we're happy to participate in anything that comes down the road with that.
Excellent. All right, well, I actually would like us to keep that meeting next Wednesday if I have any voice in that, because, you know, I think that in terms of wrapping up, it would be good, even if it's not a lengthy meeting, to make sure everybody's questions are answered and so on. So
absolutely,
if I get consulted at all, that would be my hope. So maybe you can pass that on.
I'll double check with Cindy and then make sure that, you know, Tri-West can be on the phone to answer any questions we might have about the last one, and yeah.
Was everyone else on the phone other than me recently? And that's the reason we don't need the meeting? I'm just wanting to make sure I'm not imposing.
No, I think it was just sort of a conversation with Cindy that she was unclear about the need for that specific APM, and so I think that she was not as interested in going forward with that meeting. So there were some questions about whether that meeting needed to occur, and I think from the health department perspective, we weren't willing to say, hey, let's cancel the meeting, but I'm just
right. But there are other people that participate, John, and others that it would be good to have some closure, I think.
Absolutely, and kind of sum up the project and kind of where we are.
Rather than just saying it's looking at a single element. So.
Right, and I do know that Cindy was talking to Tri-West kind of directly just to get some background about the project and some information, and it sounds like that conversation went well, so I don't know if that that just happened yesterday, so I don't know if that impacts next Wednesday, but I'll follow up with Cindy and Andrea just to kind of see where we are with that being still on the schedule, but there being some uncertainty about whether or not that was going to go forward.
That'd be great, thank you.
Okay, thanks.
Sorry to take care of my business over here, but I never get to see Ryan.
All right, I knew that.
So he's so busy now, so.
Oh, anyway, I have no other questions.
Okay, so, Mr. Chair, I would move that the board approve the order establishing fee schedules for alternative payment methodology case rates for crisis services for the Marion County Health Department.
I'll second the motion. It's moved and seconded to approve the order establishing fee schedules for alternative payment methods. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye. Motion passed.
Thank you.
Thanks, Ryan, for all your work. And I hope we do get to capture some of these costs. So that's the end of what's on our regular agenda this morning. The last thing to do is to read the places we'll be together. As I mentioned, I guess it's still going on. 10 o'clock ribbon hanging for Child Abuse Prevention Month kickoff, Oregon State Capitol, 900 Court Street in Salem. Then we leave at noon today for the Woodburn Marion County meeting. That is at Luis's Taqueria, 523 Front Street, Woodburn. Come back here at 2 o'clock for a one-on-one with elected official Honorable Janice Zirnoff. That'll be in the Silver Conference Room, 5th floor, 555 Court Street in Salem. And at 3 o'clock to 4, a Courthouse Square Green Team kickoff meeting in the Commissioner's Boardroom, 5th floor, 555 Court Street in Salem. Tomorrow, 9 o'clock, an executive session for bargaining pursuant to ORS 192-660-2D. That'll be in the Silver Conference Room, 5th floor, 555 Court Street in Salem. That's followed at 10 to 10:30, Board of Commissioners Chief Administrative Officer meeting, executive session if needed, pursuant to ORS 1926602, and just about all of them, A, B, D, F, H, and I. Again, that's Silver and Conference Room, 5th floor. At 10:30, Department Head and Elected Officials meeting, that's Thursday the 6th. That'll be at Commissioners Boardroom, 5th floor, 555 Court Street, Salem. And an interesting meeting Friday, 1:30 to 2:30, Marion County and Immigration Customs Enforcement, known as ICE. That meeting will be in the Marion County Courthouse, 5th floor, 100 High Street Northeast, Salem. Monday, Association of Oregon County Steering and Legislative Committees and Board Meetings, Local Government Center, 1201 Court Street Northeast in Salem. That goes from 8 o'clock in the morning till 3. Tuesday, 7:30 to 8:30, Staten Marion County meeting at Covered Bridge Cafe, 510 North 3rd Avenue in Staten. That's followed at 10 o'clock by a work session having to do with low-income housing property tax exemption. And that'll be discussed in Silver Conference Room, 5th floor, 555 Court Street in Salem. Then we have, at 2:30, a one-on-one with Department Head Gloria Roy. Well, we'll have to make up some special questions. And that'll be the
There'll
Silver
be legal
Conf-
questions.
Oh, legal questions. Oh, yeah, just check. So that'll be an interesting one. Tuesday, 4 o'clock to 6, Marion County Public Safety Coordinating Council, Commissioners Boardroom, 5th floor, 555 Court Street. And then Wednesday, more of a fun one, having to do with the food drive we just heard about, 6:15 to 8:30, Public Works Food Drive Breakfast at Public Works, 5155 Silverton Road Northeast in Salem. It's pretty good, by the way. I don't like to miss it. Probably won't. And then we're back here next Wednesday at 9 for our board session. Oh, this is a change. We'll be at Hubbard City Hall,
Oh, is that next week?
3720
Okay.
2nd Street in Hubbard. So if you're out that way, that's open to the public. Hope to see you there. So, again, a busy, interesting morning and day, week coming up.
Yep.
Anything you'd like to?
No,
We
back
just-
from vacation, and I've had 2 jam-packed days, so just trying to breathe. All that Hawaii
So you
lilt
didn't
is
do there,
like,
sit there and think of, oh, this is what I'll do when I get back. Did any of that happen?
well, I did spend probably a good part of a day and another part of a day working on letters of support for a grant we're writing.
That doesn't sound quite as
Yeah.
good as a lot of things.
Yeah, but that was the week that we didn't have children with us, so children and grandchildren. So when you have children and grandchildren, I mean, everything else goes out the window, so.
All right, well, I can't think of anything else. Anybody? Then let's call this meeting adjourned.